if you're like, this isn't really for me, but I love having you. So let me get this going here. Okay. Well, thank you. Thanks for joining. Our focus here will be on telehealth. The goal here is to really go over what the current state of telehealth is and what your options are as far as trying to dive into telehealth if you're looking for that. And then the vast majority towards the end of the lecture is VetTriage, because I believe that my platform is the way to do it in a gold standard way. And so we'll go through all that, and any questions you have, feel free just to shout them out. The goal here is to make this sort of informal. The proceedings for this are very, very detailed, and so you can read that at your heart's content. So a little bit about me. I graduated from Cornell University in 2006. I did my internship at Angel in Boston for a year, did 2 one-year surgical internships at Long Island Veterinary Specialist, followed by surgery residency at the same hospital. I then moved to Las Vegas, where I joined a specialty hospital there. After that, I did some locum work and then moved to Silicon Valley. I managed 3 hospitals, was on call 24/7 for all 3 facilities, did that for about a year, and then it was on call again 24/7, helping True Care expand from just overnight to multi-specialty 24/7 hospital. After that, I started VetTriage, and that's what I do now full time. But classically, I'm a board certified surgeon. This is what we'll go over here, how I came about with the idea of implementing telehealth in the vet field. We'll go over the definitions, the principles behind telehealth. We'll talk about my platform as far as what we're doing in the world. All the issues we're dealing with in the vet field currently that led up to this platform and telehealth exploding. Publications, how telehealth fits in the grand scheme of things. We'll go over an example VetTriage session, how we're seeing the effects on the floor from the platform, and then any questions you have. So the idea originally came to me during my surgery internship. I had noticed the receptionists were taking on so many phone calls at a 24-hour hospital, and the question was always the same, right? Do I have to come in? Should I be concerned? What do I do as a pet owner? And the receptionists are not medically trained. The people who are medically trained, the LVTs and the doctors, are too busy. And so the answer was always, if you're concerned, come in. That was what we used for years, and even before the pandemic, I had got wind of this and thought, this is a problem because you're allowing the pet owner to kind of decide, and the hospital may not be at the level that it needs to be to handle this influx of people. Then, if you take into account all the issues we're dealing with now with work-life imbalance, cultural toxicity in the workplace, that just amplified things. So besides having a high caseload of people who are just coming in because they're told, well, if you're worried, come in, combined with the workplace conditions, that was the foundation for a problem. And then once pandemic hit, that exploded. Adoptions went up, veterinary staff went down, turnover, the masks, not letting people into the hospital, all the frustrations with that, backing up of emergency wait times, everything just exploded. And it was kind of my prediction even way back when in 2007, 2008, which is when I started working on VetTriage, and it came to light really towards the pandemic. So when you look at the American Veterinary Medical Association definitions of telehealth, VetTriage is at the teletriage, teleadvice branch. When we think of telehealth, you have to think of all the different categories of telehealth. And so telemedicine is what most people think about when they think about telehealth. And that has a veterinary-client-patient relationship, VCPR. That is not how I operate. VetTriage operates teletriage, teleadvice, which does not require a VCPR. And that's a salient point to make, because the fear around VCPR is real. So when you look at telehealth overall, it is the overarching umbrella term to mean everything virtual. Doctor, patients, different locations, all virtual. Underneath telehealth are all the different categories that were in that chart, teletriage and teleadvice being 2 of those categories, telemedicine, telediagnostics, teleprescriptions, teleconsulting. All these teles are underneath the overarching umbrella term. So when you look at any given law or statute, or guideline, bylaw, they ought to specify what they're talking about, because telehealth is not the same as telemedicine. All telemedicine is telehealth, but not all telehealth is telemedicine, right? It's the telehealth is a broad category. And so we get confused. And so no one in the profession is up at arms about telehealth because they're thinking everything requires VCPR. How can you do what you do? It actually doesn't. It depends on what category of telehealth you're trying to focus on. So teletriage is a timely assessment of a case. Do you have to go to a vet or not, immediately or not? And teleadvice is information on the pet. And usually these things go hand in hand, because it's hard to tell a pet owner, I'm triaging your pet, not an emergency. You don't have to go to the ER. You can call your vet when they open next week. Well, what do you think's going on with my pet? That goes into teleadvice. And so they kind of go hand in hand. You sort of can't really have one without the other. But the point is that this is not relying on VCPR. These are emergency situations with clients who don't know what to do, and they want to talk to a professional with how to be directed. This is an example of a flyer that we built on VetTriage. So for example, Cornell University is partnered with my platform. So when their emergency hospital starts to reach capacity or lose staff because people called out sick, or there's bad weather in Ithaca or whatever it may be, they'll push VetTriage for level 1 triage. And so nobody enters the Cornell doors in the ICU unless VetTriage has seen them first and our veterinarians have deemed it an actual emergency. Then if it is an emergency, we call them in. So we make flyers. They can hand out to people. It's a little paragraph explaining what we are. We made a custom website for all of our partners. So here's for Cornell's website, and then the client just signs on. They join with the veterinarian in a couple of minutes on live video. And we make these flyers to be able to be printed out or emailed, add to social media newsletters. When you look at the grand scope, VetTriage is not the only platform out there, and these are kind of the basics, the skeletons of any given telehealth platform. So if you're currently in practice and you want to implement some kind of telehealth or consider partnering with VetTriage, whatever it is, you at least can be aware of kind of what sort of flavors are out there. So essentially, you have the option of either a software which allows your doctors in your clinic to provide telehealth. So you download this thing, you purchase it or subscribe to it, and then your vets have a platform they can use, kind of like FaceTime or Skype or Zoom, to have video calls. You alternatively, these software or whatever method you want to use can be non-video or video. So non-video meaning texting, phone call, emailing, etc. Video obviously is video. Then your other thoughts that you should work through is, are you providing telehealth within a hospital setting or outside, or VetTriage is third party? So outside, for example, is something like your veterinarian works that practice. They are providing telehealth consults, but they're not in the actual practice physically there. They're working from home. And it's a very popular way of doing this type of thing, where if you have somebody, let's say, who's about to give birth, you know, she still wants to work, but she can't really be in the clinic around all that. And so it's a nice way of kind of having your doctor provide telehealth. Or third party like VetTriage, where you guys focus on using your hands to save lives and we take care of anything virtual. Then you have to consider whether you're going to be asynchronous or synchronous. So asynchronous means there's a delay in communication. So if I send you a text message as a veterinarian to a pet owner, I am now waiting for a response, and vice versa. Whereas live video is synchronous. It's happening in real time. Those two things are different, and they matter, especially if you're talking about medical care, especially in an emergency. Are you going to have veterinarians or LVTs provide telehealth? Are you going to have specialists or general practitioners? What type of telehealth? Teletriage, teleadvice, telemedicine, telediagnostics? What species are you going to deal with? Who's your consumer base? Are you targeting pet owners, or are you targeting hospitals when you're trying to set up a relationship with telehealth? And then finally, what hours of operation are we talking about here as well? All those factors are considered when you talk about telehealth in the grand scheme of things. So with VetTriage specifically, we have actually broken 100,000 sessions currently on the platform in just under 4.5 years. We've had people from over 20 different countries utilize our services, so we're global. I have about 70-ish doctors on staff, because they have a flexible schedule, which is one of the benefits of working telehealth. They can come and go as they please. Almost 40 different animal types have been triaged, everything from fish to horse to rabbit, ostrich, sea otter, we've seen it. We're operational 24/7. I have a handful of support staff. These are LVTs who answer the phone lines for people who don't have video or internet and they want to pay over the phone. Then the LVT will help get them on the platform. They don't give medical advice. I'm very strict about having only doctors give medical advice, because if you're going to spearhead a movement with telehealth, I want it to be doctors as gold standard. Technicians are fantastic, obviously. They have a very important place in telehealth for my company right now, because we are at the face of this, and of course, when you're in the face of something, you're going to be scrutinized for it. I need to have it to be as pure as possible, but I have ideas for LVT as my platform as well, once telehealth becomes more sort of like accepted and mainstream. We have hundreds of partners all across the world, so Cornell uses us, University of Minnesota, a bunch of humane societies, SPCAs, mobile vets in UK, rural vets in Australia. It's all over the world. We launched a Spanish-speaking platform in 2022, and we have an equine-specific platform we launched in 2023 with the support of the American Association of Equine Practitioners, because equine is suffering even worse than small animal, and so we have an equine-specific platform because equine people are different, horses are different, and you need equine vets for those people. And then we are working on publications that we'll talk about here in a little bit. Sorry, this clicker is crazy. Okay, now let's dive into some of the challenges we're facing. Everybody here knows this, we're familiar with it, and this is just a small taste. The proceedings have way more information on this, but there's a reason for this, not just to be depressing, but also to enlighten you as far as how you can try to solve these problems via telehealth with VetTriage. So we've been told there's a veterinary shortage, and there certainly is, especially on the equine side. There's an absolute shortage of veterinarians. However, when you take into account these numbers, veterinary school admissions has increased every year by 6 to 7%. During the pandemic, it jumped by 19%, and we've added 14,500 new doctors in 2020. Well, this is certainly not speaking of a shortage. And my theory is that the shortage is not absolute, it's relative. Meaning, we're pumping out a ton of doctors, more than ever in our veterinary history. We have the largest number of vet schools in our history, class size has gone up. Where are these doctors? Where are they? And I think the problem is they end up entering the workforce and saying, this sucks, I'm out of here. And they go. And there it is. They don't care, they're not using their degree. Not that they don't care, but they're like, my work-life balance, my mental health takes precedence over being a veterinarian. I have all this debt, I have this degree, but I'm leaving the profession. And we are definitely seeing this be the case in equine, where they're retiring early like mad. On the small animal side, after their first job, I think they're gone. And it's for many reasons, lack of mentorship and work-life imbalance, things like that are factors. But we certainly have a shortage. I just think it's relative. I think we have the numbers out there, but we're not enticing these doctors to stay. Or they're joining other fields. They're going into pharmaceutical or sales or research or whatever, but they're not in practice as much. Yet with VetTriage, I have over 100 applicants waiting for work. I've never had a problem hiring veterinarians on my platform, which is great for me, but sad for the profession. Because it's sad to see veterinarians not wanting to be in the practice, doing stuff. They shouldn't be at home on a video call, you know? Suicide rates. Veterinarians are 2.7 times more likely to attempt. 7.5% have thought about it. 1.4% have planned it. Less than 0.2% have attempted. This is tied into an unhealthy psychological status, which is like a 10-question survey. And if you have an unhealthy status, you're more prone to having suicidal ideations. Unhealthiness was found in 6.4% of vets in 2019. 2021, almost 10%. So there's a mental unhealthiness to the profession that we all know about, but it's real, it's out there. Staff turnover is another very difficult aspect of the profession we're dealing with. So mental health is on top of the list. Debt is a problem. Staff shortages are an issue. These things cause challenges for the veterinarian, and that adds to this turnover rate. The burnout rate in 2021 for vets was 30%. For staff members, almost 50% burnout rate in 2021. The average veterinary team experiences 23% turnover annually versus the average annual turnover for the hospitality industry in general, 12 to 15%. So we're almost double their turnover than the general hospitality industry. And that's obviously horrific, especially when you talk about the fact that most people who work in the field are doing it out of passion and empathy. They love animals and they want to do good for them, and yet we can't seem to keep them happy. And then the new grads are the key to everything, because they're going to replace the folks who are going to be retiring, and they are struggling the most. So the satisfaction incidence with work-life balance in veterinary medicine is 40%, whereas the general population is 60%, which still isn't great, but it's 20% higher. Vet dissatisfaction is based on not enjoying the work, not finding it invigorating, having conflicts at work. We all know this. If you worked at a practice, you know these things happen. It's commonplace. And other factors that really affect the new grads are their student debt, low income when they get into practice, work stress, cyberbullying. These all play a role with affecting the new graduates, and we are relying on them to replace us. When you dive in more into the new grads, a debt of income ratio of less than 1.4 to 1 is considered not serious financial stress. But this ratio for equine vets, 3.7. The disparity between their income and their debt is insane. It's insane. Gen Zs, which are now entering the workforce, 75% of them see work-life balance as a work benefit. Not health insurance, not vacation, not CE, work-life balance. We want to have flexibility as our main reason why we pick a job, not salary, not anything else. And so I mean, this is, if this stays true, this is huge, because we've already seen the challenges with millennials entering the workforce on both sides. Now we've got Gen Z coming in, and they're really pretty strong about flexibility. So we need to figure this out and make it a cultivated environment where they're going to want to work in the profession. We mentioned this. We mentioned all this already. All the factors that relate to not being satisfied in the workplace. These are this is data for equine, because equine facilities are sort of required to be on call just by virtue of the fact that those animals are huge. They need to be hauled in, or the vet has to go there, and a lot of these people are rural, and so it's really it's not too different than small animal to some degree, but it really shines a light on the problem here. And this really speaks to the mentality of veterinary medicine. I mean, some of these numbers are crazy. 35% of on-call have support staff with them on calls. 50% do not use support, which means that this doctor is being woken up in the middle of the night to drive to a colic in the snow, winding roads with no support staff, no one to help, with procedures, with restraint, animal restraint, all that stuff. It's them and the horse owner or the help. 77% have service area radius for on-call 0 to 60 miles. Imagine living in a rural area and you're covering 60 miles of windy road, and it's an area where there's snow and inclement weather, right? 22% cover over 60 miles for on-call. Over 90% will charge an actual fee that includes the actual drive, and so that's good. You should charge for the time you spend driving, because it's going to be 1.5 hours, 2 hours plus. In 2021, it was found that over 50% of equine hospitals have 2 doctors or less. So if you have 2 doctors or less, you're going to be on call at least half the time. That's how it's going to work. And so that's a work-life balance issue. Then when you look at the number of hours per week, during the busiest time in equine, right, the most recent data, 2021, 68 hours a week during the busiest time. And even during the slowest time, it's still just over 40 hours a week during the slow period of time, which is a normal full-time job is 40 hours. Well, that's changing too. But this is no wonder people are leaving. The work-life imbalance is huge. And again, this is from equine, but it just shows you. And then finally, the most striking thing, compensation for emergency calls. You get woken up at 3 o'clock in the morning to go see a colic at somebody's location. Between 25 and 40% of these doctors see no compensation for emergency calls. Insane. 32% receive 100% of the compensation, a third. So it's like, not only are we going to screw up your life on a personal level, we're also not going to compensate you for the work that you do. So those are just some ideas. Your proceedings have way more notes than that, but you can see why the profession is struggling so much. But this didn't happen overnight. This has been happening over decades. And the pandemic just sort of accelerated it. So switching gears a bit, publications. So for VetTriage and for any telehealth platform, there ought to be science behind it. And we want to publish data. We're working on larger studies beyond this one, but this was kind of our first dipping our toes into the research world here. I've published papers as a surgeon before, but this is my first time publishing in VetTriage. We published in Frontiers 15 novel species that were aided by the platform. So we had animals on there that had never been published before to have received telehealth, and we were able to pick out 15. I was a doctor on every case. I wanted to be consistent. So it's a case series, not a massive paper, but still an okay number considering the animal types that we're dealing with. And these are the animals in this paper that we had. You can see some of these are domesticated animals, others are wildlife, but it's pretty crazy. We had a pleco fish, a chinchilla, a sea otter, horse, rabbit, goat, duck, gecko, ferret. And so, it was just a novel way of, or a way of helping people who have novel pets that never received telehealth before. These are just the video clips from all the sessions from these different animals. It's pretty wild, but that's how we do it. So we have other publications happen. They're going to be larger scale. I want thousands of animals, and I want to look at factors that influence what are factors that influence whether a case is considered an emergency or not on telehealth. And I'm starting with GI disease, dogs and cats. It's going to be a large number of animals. So that's what we're working on currently. And after that, we're going to work on probably a derm one, because those are the most common body systems. GI is number one, of course. Skin is number two. So to the process of vet triage. So again, I recognize that this is very salesy, which is not my goal here. However, there's no other company that does what we do. And so if I'm going to preach about telehealth, I want it to be gold standard, and so our platform's gold standard. So take what you want from it. If you want to partner with me, great, we'll talk about it. But I'm just going to go through the process of this. So hospitals will hear about us, usually now word of mouth. They'll contact me, we'll have a meeting. If they agree to join us, they fill out a protocol that tells us how the practice operates, like a page and a half long, it's fill in the blank. They send us a logo. We have no contracts or agreements. We do not charge the facilities to partner with us. It's all free. The client pays us directly, and that's how we can cover our costs on our end. Once I get the protocols and the logo from the hospital, I create a landing page, so it's something like this, like the Cornell one, vettriage.com/Cornell, whatever your hospital name is. We create those flyers I showed you. The protocols are created internally for our use, so we know how your hospital operates. And then your team will post on your social media. You'll add on your website VetTriage logo. You'll tell your clients either during hours or ideally after hours, hey, we're closed. Either leave a message, or if you're not sure if it's an emergency, go to our website, click on VetTriage, and talk to a doctor within minutes. And there's a small fee associated with it. That way your clients can stop visiting emergency hospitals needlessly between the stress and financial issue with that, and you as a GP want to see your client back for those non-emergency issues, and they want to see you for those non-emergency issues. So we take those cases and say, non-emergency, you're going to go see 123 Main Street Hospital next week. For now, do this at home until you have an appointment with your vet. That's the entire premise, is peace of mind. So that's how we get things set up with our partners. We create the flyers that I showed you earlier. This is an example of our non-equine platform logo, and then of course our equine with the horseshoe. This is an example of a hospital in Hawaii. You can imagine Hawaii is very unique, right? Because it's islands, and so if there's an emergency with an animal and no one's on call, you either have to wait or you have to go to the next island by plane. And with large animal, that's not even an option. So you go to their website and you scroll down. They've got VetTriage on there with a paragraph. There are hundreds of hospitals that do this with us. I'm just showing you just an example of one. This is the landing page, so your client will click on the VetTriage logo on your website. They'll get to a page that has your hospital logo on there, your hospital name, and then the client will scroll down, fill in the blanks. Here's another example of a large animal hospital, a mixed animal hospital rather. So same thing, a paragraph, the client will fill in the blanks. And if you notice, by the way, on the blanks, I don't even have signalman on here. So if you look at this, we've got email address, first name, last name, phone, English or Spanish, is this a horse, yes or no? That's it. I don't have clinical signs on here, I don't have signalman, because if I have a pet owner who's stressing out, who has a potential life-threatening emergency, and they're trying to fill in all these spots, it's going to drive them crazy. They have to fill in the cat's birthday and weight and gender. Forget it. My doctors will do all that. I need you to sign on as quickly as possible because you're a concerned pet owner, you're freaking out. So I need emails so we can send you medical notes after we're done talking to you. Name, obviously we need. Phone numbers for tech support in case your computer dies or your internet crashes. Language, and then is it a horse or not? And that's it. And so the clients can just get on it really quick. This is, I think it should play. It's a short video on the process. The reason why I'm pointing this out is because of the whole payment. Like a lot of people want to know like the payment system with this, so that's what we're showing here. But whenever people say I'm going to start my own telehealth company, I'm like, you got to think of all these factors, because you're working in areas that are very rural, and not everybody has internet or technical skills or smartphones. Some people don't have credit cards. It's cash only for these folks, right? They're very, very rural, and so we have to accommodate these folks. Here you can see we have a disclaimer explaining VCPR and what that entails and the pros and cons of telehealth. Then they go to a payment page where they can pick their payment of choice. So there's a horse there. This is an example of the equine platform, but same thing for small animal. Equine is $75, non-equine is $50. So once their payment goes through, then step 3 will light up and they can hit request session, and then they're on with the doctor. We try to make it very easy, very quick for them. So they would fill in that information, name, email, phone number, etc. Go to the next page, it'll hit step 2. Once step 2 happens, they have to agree to a disclaimer before they pay, that they understand VCPR and the limitations of telehealth. They then pay, hit step 3, and then they're on. So here's the crux of all of this. The normal workflow, and again, this is for equine, but same idea with small animal, is currently, pet owner has a concern. They call either the on-call doctor if you have a cell phone, or they usually call an answering service, or the local ER. But for these are folks who are really struggling because they're on call all the time. So the answering service sucks, and giving your cell phone out is obviously not a great idea. And so the doctor takes on every single phone call to triage them. If it's not an emergency, you give advice and try to get rest. If it is an emergency, you've got to deal with the emergency. So the problems with this is that this is not a sustainable model. The hospital team is not getting enough rest, burnout, difficult to recruit. The costs outweigh the fees earned from emergency care, and there's no revenue generated for these non-emergency calls. You're not getting paid for that free advice, so that's a loss, and you're losing sleep over it. And then there are safety concerns. You have to drive to a remote location, either your clinic or the person's home where the horse is or animal is. Or if you're a small animal, then you have to drive to your clinic to meet the client there. And so if you're in this scenario, or if you're trying to avoid your clients from having to go to the emergency hospital needlessly, waiting 6 hours, paying $500 for a broken toenail, right? Not only does the ER staff not want to see that case, your client doesn't want to be there if they don't have to be there. So with VetTriage, the person has a concern with their pet, they contact VetTriage, we get on the video with them. Over 80% are non-emergencies. We're going to give them advice and monitoring parameters, and then go see your vet. You can't stay with us. We're not a hospital. We're not a brick and mortar facility. We're not a virtual facility. This is purely triage. So you got to go somewhere else. You're going to go to ER if you're an emergency, but most are not, and they're going to go to their family vet. If it is an emergency, we're going to follow the protocols for your hospital. Maybe you have, in your location, there's 3 emergency hospitals, and you hate one of them, and you prefer your clients to get sent to the other 2. Then we'll follow your protocols accordingly. If you are an on-call facility, we have all of your on-call schedule, we have your phone numbers, we have your fees. None of that's shared with the client. They don't get your cell phone anymore. We're done with that. We call the doctor on call and say, hey, I've got a possible GDV. They approve the fees. They live 20 minutes away. When can you see them? All right, have them meet me in 45 minutes at the clinic. I'll get ready and leave now. Great, thanks, doc. Call the client. Okay, doc, we'll meet you at the hospital in 45 minutes. Get in there, bring in your meds, your medical records, and then they'll take care of you from there. Most of the time, it's not an emergency, and we're saying, good news, not an emergency. Do these things at home and call your family vet at their next availability. They'll try to see you. So this is where I feel telehealth, plays a role. It can bridge the gap between all these facilities. For GPs, you'll have assurance in knowing that your clients don't have to keep going to the emergency room needlessly. They can talk to a doctor live at a fraction of the cost and get sent back to you, so you can get that client loyalty and that revenue and as appropriate medical care as an appointment with a family practitioner. If you're in an emergency hospital, you can stop hitting those long wait times, see cases that you want to see that are true emergencies. Those that are not emergencies that annoy the staff and don't really bring in much revenue, we can get rid of those. Lower your wait times down so you don't have dogs dying in the car and people putting online reviews that are negative and whatever else. Rescues and shelters, right now, they either have somebody on call, or if the foster is concerned, they go to the ER and rack up a bill for a case that probably didn't have to be there. And so we help rescues and shelters by taking care of their fosters. It's a fraction of the cost, and they're saving hundreds of thousands a month from avoiding emergency fees, which then can be used to save more animals. get them in their forever homes. And then especially, of course, post-op cases, clients have a concern about the incision or whatever, and then they can consult with telehealth and say, hey, it's not an emergency, don't go to the ER. You know, you just spent $5,000 on a TPLO, now the incision's a little bit bruised up, that's okay, don't go to ER, where they're gonna do all these tests and come to the same conclusion. And just a reminder of where we live in this circle with not requiring WCPR. This is an example of a session. I don't know if the audio is gonna work. If it doesn't, I can just kind of give you the gist of it. We'll see if it works.
Hello there.
Hi.
Hi. I'm Charolette. Nice to meet you.
Nice to meet you. I'm Erin.
Is it audible enough or too low?
So I'm fostering. Well, they were two pregnant. One had her kittens on Friday. The other one. The other one. So she was fine, and then one of my main cats got under the door and stressed her out a little bit. And then, like right after that little tiff she had with the other mom cat, she started like acting a little bit more weird, trying to go up to the mom cat. And then she was like, kept trying to go back to her, and her attention, she wants more attention now. She's purring pretty rapidly more. Very minimal discharge, so I don't know if she actually is going into labor, but she keeps trying to lay in the bed with the other cat, the kittens. So I'm just, did maybe the stress just cause something, or is she in labor? Do I have anything to worry about?
Gotcha. Okay. All right. Cool. How old is this gun?
Honestly, I have no idea. We got them from, this is gonna be this cat's third litter.
Okay.
So,
Well, my next question: how many litters does one have? Okay, so this is the third litter. Very good. And do you know approximately when she, I guess, how long she's been pregnant for?
probably around the same time. So, like, I really don't know. I got them when they were already pretty pregnant. So I've only had them for about 3 weeks now.
Okay.
She's not as pooped out as the other one was right before she gave birth. So maybe she's just a smaller litter, and her nipples are still,
Yeah.
like,
And then
still.
how many babies are in there? Are they want to take an X-rays?
No, this is like been home stuff.
Gotcha.
I feel maybe like 3, but sometimes it's hard to tell.
For sure. Let me look at her. Let me see. If you were to pick her up and then like put her on the bed, can you do that and then kind of watch what she does?
Yeah.
Okay. Let me see. No. Ooh. Let's see what she's doing here. Is she on any medications or supplements?
No, she's not on anything. She's on kitten food and then wet food once in the morning, once at night. So she went back to her bed, but earlier she just kept trying to go back to this cat and her kittens right there. So
Gotcha.
now she seems to be going back to here, so now I'm thinking she's in labor, but she really doesn't have a lot of discharge.
Yeah.
She has some, but not a whole lot.
No, here's the thing. I agree with you. I mean, the nesting, the neediness. I think that's all. I think she is, if not in labor, going to be in labor tonight.
Okay.
This is really, so what I would actually think of doing, if you're okay with it, is just minimize stress in the room. Maybe dim the lights, kind of give her her own space, let her do her thing. Watch her from a distance. And see what she does. Have food and water available for her and see what she does.
Okay, and then I guess my next question is, so originally me and my sister were gonna like each take one of the cats. So if she does take this one, it would obviously have to be after she's had the kids, right? Because you don't want to stress her before she has them.
I think so. I think it's a smart idea. Whatever we can do to minimize stress in this cat's life.
She's having contractions.
Yeah, there you go. Yeah. Let her do her thing.
Okay, so then after she has the kittens, what's like a good time frame that she could be moved with them? I just don't want any stress for the other mom, and I don't want continued stress for her. They're okay for the most part, but
The easy answer is no one knows then, right? But I will tell you that as a board certified surgeon, having done plenty of C-sections, dogs and cats, I will say that the second day, the surgery is done, the mom's awake, the kittens are awake, the kids are nursing, mom is good, I send them the hell home, like they go. And it's literally hours after surgery, hours after giving birth to the C-section. So I would say the second the kids are out and they're nursing, mom is good, move them whenever you want.
Okay, alright.
Yeah.
I think that's it. I mean, she might just have a slower labor than the other one did, but.
Let's do this. It's still early in the night. I'm going to email you, and I'm going to send you a blank email. I'm going to send you a blank email. That way, if you have any updates for me, if you want to send me pictures or videos and say, hey, doc, it's been 3 hours. Here's what's going on so far. What do you think? Or whatever. Or you may not need me, but let me at least send you a blank email, and that way you can have access to me beyond this video session, so you make sure things are good with mom here.
Okay, alright, I appreciate that.
My pleasure, of course. But yeah, I think you're on the right track. I would say dim the lights, let her chill. And I don't know if having the other mom and the kids in the room is more stressful or more relaxing. It's kind of your judgment call.
Yeah, I mean, the only other option would be to have her give birth in my room, away from the other cats that are in my house, and then her, but then I'm not sure if that new environment would also make it just more stressful for her, because there's a bunch of new smells. The other cats' smells are predominant there because they sleep with me.
Then yeah, whatever it is least new, I would say is.
Okay, so just keep her in here and keep an eye on her.
Yep, that's fine. Just dim the lights a little bit, keep it kind of chill.
Okay, alright. Well, I appreciate your help.
Of course, my pleasure. I will send you a blank email here, and we'll get you and just keep me updated if you want to. Yeah.
Okay, great. Thank you so much. You have a good night.
You too. Bye-bye.
Bye-bye.
And then a couple hours later, we got pictures and email, mom, kittens, everybody's good. And so this is a great example of don't drive to the ER, you don't have to be there, they don't want to see you there, it's stressful for the mom anyway, it's going to cost you more money than it needs to be. And so we can give ample advice and take care of folks like this. So just to summarize here, some of the effects that we're seeing on the floor with VetTriage partnerships, it helps with retention and there's less turnover. I've actually had veterinary hospitals owners say, I'm leveraging the fact that we're partnered with you guys to attract new graduates, because then they know that they have to be on call, which sucks, but VetTriage will cut out 80% plus of these cases, of those phone calls. And so you lose less revenue with trying to headhunt and keep training new staff, a more cohesive team, improved hospital culture. So if we can ease the stress from you guys when you reach capacity, or when you have people call out sick or whatever it may be, you can offload cases to VetTriage, so it'll lessen your compassion fatigue. Individual patient care improves. It's so annoying if you work in the ICU and you have these 3 or 4 really sick critical animals, and some bouncing, yapping puppy comes in for lameness, and now you have to have 2 staff members hold this dog down, examine it, and whatever, and you've got critical patients, a septic abdomen, a pyometra, a thoracotomy. That's annoying for the staff, and the dog does not have to be there. So if we can help with that, even better. So with new graduates, you can kind of tailor the caseload based on what the graduate can handle. So any other case can go to VetTriage, and that way your young vet can focus on what they can handle in the hospital. And then we have everything tailored to the clinic to fit their own protocols, how they want us to operate for after-hour emergencies with clients, whether it's go to the ER or the on-call or whatever it is. But the point is that your clients will get peace of mind as far as what to do. And so common questions that I get with clinics that inquire about us is, VCPR is a very common one, but we already addressed that. This is teletriage, teleadvice. We are not aiming to create a VCPR. That's not our goal here. My clients need me. Yep, they ought to be tied to the practice though, and not the practitioner. And then we're an extension of your facility. The client does need you, but they need you in a rested state, full of compassion and not exhausted and frustrated. The clients needs about 1 minute to log in and pay, and then average wait time is 2 minutes to talk to our doctors live on video. It's frequently like 30 seconds, but average is about 2 minutes. My clients are used to being able to call me directly anytime, but we need a culture shift, and that's the premise here. It doesn't matter whether you're partner with VetTriage or leverage telehealth, we need to figure out a way to improve the culture, because we're not sustainable right now. Things are not going in the right direction, and we keep pumping out more grads, and we're not seeing an improvement with work-life balance. My clients might skip us and use VetTriage. That's never happened. Clients always want to talk to you. They always want to see you. They're going to use us if you direct them to us because they want to talk to somebody at the end of the day. But they're always going to try you first. They're never going to skip you. My hospital has very specific situations or unique geographic location. That's fine. We handle very rural areas, islands, you name it. We can customize protocols to it. It's not the same as building a new hospital in your area, but since that's not going to happen, we can take care of your clients virtually, despite whatever unique stipulations or geographic locations you have in your hospital currently. What about follow-up questions or concerns? Maybe the pet's condition changes. So the clients can always email and call us after their session with us without paying again, and we'll basically take care of the client until your hospital's open. That way, Mary Smith on a Friday night with a dog that's got stress colitis knows that she's got us until Monday when you guys are open again, and then presumably on Monday, when you get our medical records, your front desk will call the client and say, hey, Miss Smith, we heard Fluffy saw VetTriage on Friday for diarrhea. How are things going? Oh, she's doing better, but I'd like to be seen. Let's get you in this Wednesday. How'd that sound? Sounds great. Get her in, and there you go. The whole process works really well. So we want to make sure that clients are taken care of at no additional cost until you're open again. Well, right now my hospital performs triage for free, so why would I do this? There's legal and ethical concerns with that. You don't have a VCPR with those clients, you're doing it over the phone, and plus who's triaging? Is it the doctor? I doubt it. Is it a technician? Maybe. Usually it's like a CSR or like a really experienced receptionist, not medically trained people. And so you want to be cognizant of that. Plus, you're allocating a team member to be on the phone triaging, you're not bringing in any revenue, and that valuable technician who should be on the floor giving injections and running diagnostics and saving the day, she or he is stuck on the phone. Triaging somebody who doesn't need to come in, or you don't know if they need to come in, but it's a waste of your staff. And so you're using your staff for this purpose. You're not even charging for it, so it's just not a great way of doing it. I say abandon this. It's a waste of your time, and let us do it. Let us not take on the liability for it. What about urgent care? I'll talk about that in the next slide. Urgent care has been up and coming for a couple of years now. And for folks who want to work for the company, they can just email me. But we don't have a problem in that regard, and it's very hard to retain staff in brick and mortar. So I do not hire veterinarians who work for any of our partners. That's not the goal here. Unless they tell me that their hospital knows they're pursuing a VetTriage position, then it's fine. But otherwise, we're not looking to scalp people. This is the urgent care model. To some degree, there's variations of this. Hospitals will put on their website different levels, and the client goes on there and they think, okay, my cat has a mild lameness, so it's not urgent. All right, I guess I don't have to go in, But you're letting the client decide what's urgent, what's not, and of course they're not medically trained. And a lot of us would consider not eating probably not urgent, but if you have an obese cat who hasn't eaten for 3 days, yeah, hepatic lipidosis is a problem now, and so a pet owner isn't going to read into that. They're going to say, oh, not eating. All right, level 3, I can wait it out probably, when really the cat's bilirubin is starting to go up and getting fatty liver disease. So I'm not a fan of this. I want veterinarians to dictate whether something is urgent or emergency or whatever, and not the pet owner. So I see urgent care just going to become another variation of ER with the same sort of challenges. So we're almost done here. Workflow, you are giving your cell phone or using a call center. Again, these are for people who are on call. Your hospital may not operate that way, and that's fine, but we're going to replace those measures. And then we're going to email you medical records. Those records will be time-stamped and date-stamped, so you'll know what time and day this occurred, what happened, what the communication was. What if my client's unfamiliar with technology or doesn't have service? We have a phone number that we give to our partners, so your clients can call. It'll be answered by our technicians, who will then process their payments, get them on with our doctors for medical advice. That way we can take care of folks in all different areas. Liability is on us. Our contractor agreement is with the client and not with you. So you can have faith that our doctors, who are skilled and knowledgeable, they'll take care of your clients, and the liability is on us. How do I know that our DVMs will give good advice? We have high standards in the platform. I interview the doctors myself. I'm a board certified surgeon. I'm looking for a little bit extra from our veterinarians who join the platform. And so they have to have ample clinical experience, be able to communicate well, resonate well on video. And so we hire veterinarians who fulfill those standards. We don't care about prescriptions, and the reason why is honestly, most clients, the vast majority, they don't ask for medications. They're not coming to virtual care because they want antibiotics. They're coming because they want peace of mind. They're freaked out. They don't know what to do. They can't afford to go to ER. They can't drive there. They live on an island. Their dog is a nightmare in the vet hospital, whatever it is, right? They want to make sure, do I have to go in or not? So this discussion of prescriptions, although it is opening up, we are seeing virtual VCPR now. That's going to be a thing, and it's not going to go anywhere, and it will spread. But as far as our concerns are, we'll leverage medications and OTC products that the client already has access to. Benadryl, antacids, wound care, e-collar, diet change. These are things we can implement that are not prescription and will make the pet feel better and have the client doing stuff with their pet. So, and then if we do have to call in an emergency case, we're gonna package the case, call the ER. Hey, I got a 5-year-old Great Dane with these symptoms. I think it's a GDV. They live an hour away. They know that there's surgery involved. If you confirm it's a GDV, can I send them over to your ER? You know, and they'll say yay or nay. They say no, we'll look for other places. They say yes, we'll send them on over, and then have it where the emergency doctor it's all packaged. So by the time the doctor and the client meet after seeing us, you spend less time investigating the history. You know what they're coming in for. You know the background. You just have to confirm what you're seeing with a physical exam, because we only can do a virtual exam. Diagnostics, go save a life. And then finally, a last slide here, testimonial. Thank you for the excellent evaluation. Your recommendations for our dog Cruz were absolutely correct. Your intake and thoughts about how we should support and care for his injury yesterday. He did a miraculous recovery. He's running top speed, attempting to pull off a naughty jump on our bed this morning. He's managed to the point where we are certain that a follow-up with our vet is not needed. However, we did speak with the office today, and I also congratulate them on their selection and use of VetTriage for after hours. I can't say thank you enough, Dr. Bercier. Thank you so much. And we get this stuff all the time from clients and from our partners. So our partners will say like, oh, this is my first Thanksgiving I've had off for in 20 years. I got to spend it with my family, still on call, and didn't get bothered once. That's a win, fantastic. We've kept hospitals open because they wanted to close due to staffing. We said, look, don't close. Use us for a bit, see what happens, and then we extend their lifespan. And so it's been very, very fulfilling, this type of platform. So anyway, hopefully this talk gave you some insight on the world of telehealth, what's involved with it, if you're going to do it yourself or not. This is my contact information. Feel free to reach out on any social media platforms or my email. This QR code gets you to the VetTriage website. And I will now be happy to take any questions you have. Yes?
I noticed about your company, but I just had some interesting, wanting to understand telemed better in general. So if you are, I assume that if you give incorrect advice, when you have that disclaimer up front, they sign off that if you don't tell them right, they can't sue you, or how does, or if someone, I see a vet's prescribing medication, not seeing the animals, not putting their hands on the animals. I mean, how is that done through disclaimers, or how does that work?
So I can't comment on the prescription part because there's only 2 states that I know of for certain that have virtual VCPR. So the vast majority don't. And so if they're doing prescriptions, I assume either they're doing it inappropriately or they have a VCPR of that client. They're just doing telehealth outside the brick and mortar. That I don't know. But the other part of it, the how do you handle the legality, the disclaimer part of all this? We have multiple levels of this. So number 1 is the landing page we create for our partners has a paragraph as to what the purpose is. We're going to tell you if you have an emergency or not. And if you don't, we're going to give you advice. Nothing in there about diagnosing, about prescribing, or like promising you an outcome. Secondly, we have the disclaimer that says about VCPR. What's in that language also explains the common sense pros and cons of virtual care. We can't touch your pet. We can't run diagnostics with your pet. We are subject to what we have available to us. Some people can't even catch their pet. They're just giving us a history on video, and the animal's in the bed, underneath the bed, and the cat won't come out. So now we're trying to figure things out without seeing a patient. You know, all you can see are glowing eyes under the bed, and you know, is it a blocked cat? Is it an asthma attack? You know, and then finally, when we email the client the summary of the advice given, at the very bottom is more legalese, saying on there, keep in mind, we have no access to physical exam or diagnostics, but if you notice a change with your pet that's worsened, you call us or email us for free, we'll re-triage your pet. And so that way it puts the onus on the client. It's their responsibility. If our vet, quote unquote, missed something, that client ought to give us a call back and say, hey, look, he's not doing that well. Things are progressing here. I'm now seeing X, Y, and Z. In addition to that disclaimer, we actually have a list of symptoms to look out for. If you notice abnormal gum color or difficulty breathing, etc. So, long-winded answer to explain that we have multiple levels of protection on our end. At the end of the day, though, this all leverages in the fact that it's triage and advice. We're not diagnosing, we're not prescribing. I'm going to tell you, I think your cat is blocked. I can't confirm that. I think you've got a GDV or HGE or just a sprain of the ankle. I can't confirm it, but I think it's what's going on. Here are the other possibilities. Here's what we're going to do. And then you let me know if things change. If I'm wrong and that those urinary signs are actually an obstruction, well, here's what I need you to look out for. And then we'll change the plan. We'll change the plan from there. So in over 100,000 cases, 0 medical board complaints on the platform, because people understand our doctors are fantastic. Our partners set their clients up appropriately to say, here's what you can expect, you know. And an experienced clinician who's seen these cases hundreds of thousands of times, you can tell emergency or not. So, is it foolproof? No. At some point, we're going to get in trouble at some point, but then we'll tackle it. Because if you look at the numbers of medical board case complaints in brick and mortar, it's astounding. Whereas virtual care, it's almost 0 across the board. So it's just.
If you word it right, you know, like this is advice.
Yes.
My hospital's trying to get me to do that in integrated care.
Mm-hmm.
Because I'm the only one who does it. And there's lots of things where some hospitals don't have the capability to do certain things because there's just not somebody who knows, you know, like, but also what you're talking about, it's a routinely we have 4 out in Baltimore, 4, 5 now ERs, and it's not uncommon for them to be completely booked.
Mm-hmm.
And my clients are on a waiting list for 12 to 24 hours.
Mm-hmm.
So I'm going to bring that back to my hospital. I like that model, but they also wanted me, and I just didn't, you know, they handle stuff that nobody else can handle. So
Mm-hmm. Mm-hmm. Yeah.
I'm not working in the hospital anymore. I'm too old.
Yeah,
I
yeah.
was just wondering about the telemed stuff.
Yeah.
You know, like what is the liability of a veterinarian not integrated care? I mean, that's, but of course you get liability. But like if you misdiagnose a GDV and you don't recommend them going and the dog dies, you know. So,
Yeah.
yeah.
Yeah,
It's
yeah.
like you have your bases covered on that.
The communication is key, right? That's a cliche phrase, but that's really true. My doctors word things in a way that explains to that pet owner, this is what I think's going on. This is probably worst case scenario what's going on here. But it may be these other less emergency things. Or I think you don't have an emergency here, but it could be more emergent things. I don't know yet. I don't have enough information, but so far from what I can see right now, what you've told me, I wouldn't go in for this. It sounds like a stress colitis case. Not HGE, not parvo, not whatever. But if something changes tonight in the next few hours, I need you to let us know so we can change the plan if needed. Otherwise, you're going to do bland diet, antacids, probiotic, whatever, and then call your vet when they open. The other thing I was going to mention was, the language. This is the reason why on our platform, I call these sessions, not consultations. I'm trying to stay away from the wording that you use in brick and mortar that ought to be unique to brick and mortar. I stay away from it. So it's advice, not recommendations. It's sessions, not consultations. I focus on that heavily, and all of our language is like that. Not that it's like that's not some novel way of thinking, but at least it separates us to some degree from brick and mortar to be like, we're doing things a bit different. I want softer language because we don't have diagnostics. We can't tell you things with certainty because we have no diagnostics available to us. Yeah. Any other questions?
So are you currently only associated with brick and mortar facilities, or are you just available as a website for clients for anybody to reach out?
So initially, when nobody knew about us, it was all clients who would Google us or hear about, I heard my sister used you last month and now I have a problem with my pet, right? It was word of mouth and Google searches. Now 85% of our cases come in from referrals. And that's what we wanted from the beginning. We wanted clinics to say, here is an option for after hours. It's affordable, it's convenient, there are doctors, it's video, it may save you the trip to the ER, right? Simple as that. So the vast majority of our traffic comes in. So the clients can find us still organically, and some still do. Most, 85% plus, are from referrals. Yeah, we never wanted to be seen as a competitor to hospitals. That was never the goal, because you can't meet the standards of in-person care. You just can't. You can be the best televet in the world. You don't have diagnostics, and so even if we know, as experienced clinicians, we know 90% of the diagnosis is history. The other 10% is I got to confirm it with some tests, right? So if you're triaging, I don't have to know the answer. I have to know it's an emergency or not. I don't have to know if it's Cushing's or diabetes. Just is it an emergency? Yes or no? And so anyway, so yeah, you can still find us, but most of it is referral. All right, thank you so much. Thank you.